This is Dr. Toby Moma, President, Faith and Power Ministries, inviting you to watch our new series on this station. It's going to feature a hospice nurse, Mrs. Beth Westmoreland. She's the hospice director of nursing for Crosslands Hospice and also the administrator. She works out of Delhi, Louisiana. And we want to talk to her about what hospice nursing is all about. Many of you have questions on hospice. You don't want to miss the show. Tune in. We're going to be talking about faith. We're going to be talking about the future. We're going to talk about what the afterlife looks like. Miss Westmoreland trained at some of the best schools in the area in Northeast Louisiana. She got her associate's degree in nursing. She's a mother. She's a grandmother, and she's also a member of the Assembly West Monroe. And she's going to be pouring out her heart into the different dimensions of how the faith of God has shaped her hospice ministry. She's explained to me multiple times that the hospice is not just a vocation, it's actually a ministry. You don't want to miss what she has to say. God bless you. Hi, good afternoon, good morning. Anywhere you're listening, this is Dr. Toby Moma, family physician, host of Health and Wellness with Dr. Toby. Don't touch that dial. We're excited to have you on the show today. We have a great guest on the show, Mary Beth Westmoreland. She's the Director of Nursing and the Administrator at Crossroads Hospice in Delhi. And she's a Christian, she's a believer in Jesus Christ, and she's been sharing her background. Today we're going to talk about her role at the Crossroads Hospice. Mary Beth, you're welcome on the show.
Thank you so
Real
much for
pleasure
having
having
me.
you. So tell me a little bit about Crossroads Hospice. When did it start and what is it all about?
Crossroad Hospice was started probably, I don't know the exact time, date, year, but probably about 10 or 11 years ago. I came shortly thereafter, so I've been there about 9 years. Um, it's owned by three physicians in the area, and there was just a need for hospice in the area because at the time there was no hospice really in the area at all.
So they serve as the medical directors, I guess, and then you serve as the director of nursing.
We have another physician, Dr.
Okay.
Kenneth McDonald, there in Delhi, who's one of our medical directors.
Okay.
We also have Dr. L.P. Newman and Dr. Corey Albritton as assistant medical directors.
Okay.
So yeah.
So what does Crossroads Hospice? I love the name Crossroads.
Yeah.
I mean, was it because some people use the word crossroads. I know Charles Stanley has a devotional called Crossroads, and I know some people do some Bible studies called Crossroads. So, do you think the name was from a Christian perspective or just?
I really don't know about that. I don't know. I would like to think so because of the way our logo and everything, the way the logo
Right.
is, we've made sure the cross was really prominent, real
Right,
prominent
right.
in
So
the.
what do you do? I mean, what does Crossroads Hospice do? I mean, my viewers, trust me, they don't know what a hospice is. You might want
Right.
to tell them a little bit about what a hospice is and then what Crossroads Hospice does.
Okay. Hospice is we're kind of like home health, but we are geared more towards the terminally ill. We go into the patient's home, into a facility like the nursing homes if we have a contract with that particular facility. The patient must have Medicare Part A, any kind of private insurance that would cover hospice, we would accept. Um, we focus on life's quality versus quantity. We try to make sure that the patient stays comfortable until the Lord calls them home. Hospice doesn't do anything to expedite the dying process, but we know that there's a time to live and a time to die, so we try to make sure the patient stays comfortable until the Lord does call them. So we have nurses, social workers, we have nurses' aides, chaplains as well, as part of what they call the IDT. That's our team. So hospice treats not just the patient from a physical standpoint, but also spiritually, emotionally. We come from all angles. So that's kind of That's basically what we do. You know, it's not always for cancer patients. It could be for Alzheimer's, Parkinson's, COPD patients,
Heart failure.
heart failure. A lot of people think too that they have to be on death's door before they get hospice, and that's not true. We've had patients literally for years on our service, and Medicare is okay with that as long as the patient declines. It could be an infection, it could be weight loss or whatever, but they have to show some kind of a decline for Medicare to justify them to stay on hospice.
A lot of people I talk to, they're afraid of hospice because they think they're going to stop my blood pressure pill, stop my diabetic pill, stop my
Right.
cholesterol pill, and then put me on this narcotics and I'll
Yeah,
die within 3 days.
that's
That's the impression
that
90%
is.
of people
You're
have about
right.
hospice.
It's
So
very
can you
true.
tell them, do they have to stop other medicines they're taking?
No, once you get on hospice, depending on what's going on with you, we're not going to have to change anything. Now, with time and depending on what your diagnosis is, with time, sometimes we may have to tweak something. Maybe their blood pressure is starting to go low because they're not eating and drinking
Right.
as they were prior. So we want them to continue everything that they've been doing, medicine-wise, as long as they're comfortable. Um, with time, you know, we will have to probably go up on pain medicine just because your body becomes acclimated to a certain dose, excuse me, to a certain dosage of medicines. So, but we would never, Crossroads would never start anybody off on a high dose of pain medicine. We start them off really low. And sometimes, honestly, if it's like a bone cancer patient, they could benefit more from Motrin and prednisone versus morphine and
Then
Norco.
right.
Yeah, so
Then the other thing a lot of my patients wonder is, I can't afford it. They have Medicare Part A, but they keep saying, I don't want to get the bills. I don't want to get the bills. So can you explain how you're 75, God is preparing you with, this terminal disease going on. A lot of them are worried that they will get a bill that they will live their dependents
yeah.
with. So can you explain the way the Medicare hospice payment works? Is it going to leave a bill for the future dependents to pay for the rest of their
Right.
life?
No, Medicare Part A will pay for your hospice care 100%. So we get that money that they give us, and we will pay for your medicines related to your diagnosis and your comfort. We will get that money and use it for your DME that you need at home, whether that be a hospital bed, oxygen, whatever, and your supplies. So like if you're on a peg tube and you need the milk, the hospice service pays for that. Diapers and briefs and all of those kind of things. So you will never get a bill, or your family will never get a bill from hospice.
Okay, that's reassuring. Um, some people are wondering, can I still go to my regular doctor while I'm on hospice? I mean, these are all questions they ask me. Since we have
Right.
the expert here, I'm going to throw that question to you.
Yeah. Well, it kind of depends on what's going on. We do ask, I mean, because this is the thing, when you're signed up on hospice and say you have cancer, it's kind of redundant or irrelevant to go to a specialist, because if that doctor, your oncologist, has said that there's nothing else that can be done, it's irrelevant for you to go back to that oncologist. So that's when we would get the call. So no special doctors, no oncologists or anything like that. As far as your primary physician, it kind of depends on what's going on. Typically, we can talk and converse with the primary doctor. If they need to get lab work from you or something, we can do that.
Okay.
It kind of just depends on the situation.
Oh,
We try to not let them do that, but sometimes if that makes them feel better, then that's okay.
then a
It
lot of
kinda-
my a lot of my viewers have heard horror stories about I don't know if you heard of, there was a doctor in Detroit, Michigan called Karbokian, and he was killing patients, and he actually went to jail, and but he's free now, and his name was Dr. Karbokian, and he will inject patients with an overdose of morphine,
Right.
and that was the first case of physician-assisted suicide. So I've heard this from patients. They are worried that they may be overdosed to die early so that the
Yeah.
hospice will get the financial benefit. How do we tell them that's not the truth? Especially with Crossroads. I know you guys are ethical and all that, but I doubt if any hospice would do that. Am I correct?
That's right.
Yeah.
Because the thing about it is, we all benefit the longer the patient lives. We don't get paid unless you're alive. So there's really no, I mean, I'm just saying from a financial standpoint,
Right.
um, a hospice can never benefit from a patient dying early. We want them to continue living and doing whatever they want to do from an ethical standpoint and from a financial standpoint. That's what we desire. So, to be honest with you, our hospice has been very well known as far as being probably borderline a little bit aggressive as far as making sure patients are clear of an infection or whatever. Like we go over and beyond because we want them to continue to live.
To live, right.
It can kind of get a little bit sticky at times. We don't do a lot of IV fluids, that kind of thing. But we do want them to, if we can treat them at home with IV antibiotics or IM antibiotics, we'll do whatever we can.
Right. You want them to enjoy
Yeah.
those few months or years that they have.
That's right.
Which is what our call in life is. Jesus said to give you life, and I think Paul said that his will is that you enjoy life. Amen.
That's
So
right.
that's, I think, First Peter 3:10 says the
Right.
will of God is that you enjoy life and live long days.
Yeah.
But talk to me about you as the director of nursing. What is your role in Crossroads as the administrator as well? That's two major hats, and I know you have an assistant director of nursing, so you must carry a lot of work on your tail.
Yeah, we've been we've been very blessed there by just having an influx of patients to last a little bit. So it has made the workload a little bit greater than normal for us. But my job as a DON is just to kind of oversee the care of the nurses and what the patients are getting. To just kind of go through charts, making sure everything's legit. Making sure the patients are being taken care of, that we're doing everything that we can from a medical standpoint to make sure that they're comfortable. Administratively, it's just a lot of paperwork, that pushing papers around and stuff, and
Right.
yeah, that's pretty much.
What's your opinion as a Christian, as a nurse? 7 states in America have legalized euthanasia. What is euthanasia for my audience? Euthanasia is when a patient chooses to kill himself or herself. So they say, give me all my morphine, give me all my Narco,
Yeah.
give me all my Demerol, give me all my Dilaudid, and they just take it, and the doctor who gives it to them is aware that they're going to do that. So it's legal in 7 states. It became very popular when a girl in California moved to, I think it was Oregon, or I think she was in Oregon and she moved to California, but she had a brain tumor, and this lady literally recorded the last days of her life on YouTube or on Facebook, and she literally died on Facebook. And people have come out, and there are 7 states: Vermont, Oregon, California, Washington, and a couple of other states have legalized that kind of personal suicide. And so, what's your opinion as a Christian, as a nurse in the hospice field? I mean, because there are questions ethically about this. And some Christian nurses are like, I can't do that. I don't want to see somebody die. My oath is to bring life, not death. So what's your take on euthanasia? Then the second one is, and I know you probably know this, but in Europe it's legal. In the Netherlands, it's been legal since the 1980s. So they're trying to bring that same spirit to the Americas. There's also what they call physician-assisted suicide, which is a new thing. It's in about 2 or 3 states right now. It was recently defeated in California. But physician-assisted is different. PAS, physician-assisted suicide. Basically, the doctor intentionally injects the patient with an overdose to make sure he doesn't wake up. I mean, they did that during Katrina when people were in nursing homes, and
Yeah.
the doctors felt instead of them suffering. I don't want to. They're gonna die here. The flood can't. They can't get their oxygen. So the doctor started giving them an overdose. As a Christian, give me your thoughts on that, especially with somebody who works in this hospice field. What's your thoughts on euthanasia and physician-assisted suicide?
Yeah, that's a sticky one. I definitely I would never want to be put in that situation. As a Christian, I couldn't do that.
Right.
Yeah, I believe that the Lord is the one that
Gives life.
he
Right.
gives life, and he's the one that takes life, and I couldn't do that as a Christian. I could never do that.
And in Europe, it's becoming a situation because what happens to a man who's demented and he doesn't have capacity to make
That's right.
decisions? So suddenly the doctor takes it upon himself and says, I don't think your father has the quality of life. I'm going to
Yeah,
do a PAS. And the family is like, how do you know he wants that? And
that's
they're
right.
like, and the doctor says, well, I can make the decision. So families are thrown under the bus because they're literally being told we're going to take your father away whether you like it
Wow,
or not,
wow.
and the father has no capacity to tell the doctor yes or no.
Right,
And at
right.
times what happens is that the doctor says, well, when he was in his right state of mind, we heard
Yeah.
he wanted this and all that, but it's not true. Tell us a little bit about DNR and hospice, do not resuscitate. Is it automatic or is it a personal decision? Tell us a little bit about DNR, because I know for my medical people listening, so DNR means do not resuscitate for my non-medical people. So when a patient comes to the hospital, there are two things they sign all the time: a DNR, do not resuscitate, and a DNI, do not intubate. They tell us, I don't want you to press my chest, I don't want you to put a tube down my throat if I happen to go into respiratory or cardiac arrest.
Right.
What is the state of DNR, DNIs in the hospice?
They can be on hospice and not necessarily be a DNR. We would
Okay.
encourage that the patient decide to be a DNR, but it's not necessary. Typically, what will happen is once you get a patient on hospice, they're still in denial, and they're still got that, you still want to fight, and we want you to continue fighting your disease and stuff. However, as the disease progresses and everything's starting to seep into the patient, and they realize, okay, maybe I am terminal, maybe things are, or the family would make the decision. Maybe they've been the ones in denial. But as time goes on, they will typically go ahead and sign the DNR. And most of the facilities, if we're going into a nursing home and the patient has hospice in the nursing home, typically the facility, just to cover themselves, they will encourage highly that if the
DNR.
patient's going to be on hospice, then they need to be in DNR. So in a home situation in hospice, it's kind of we can kind of play with it for a little while, so to speak.
Interesting. I'm getting a lot of education. I'm sure you are too. What is the role of the medical director in a hospice? You are the director of nursing. What does the medical director do? What's your relationship with him?
Yeah.
And how does he collaborate with you and the other staff? And is he the one who, you know, says that the patient is now dead? Does he certify the patient dead, or do you have to call
The coroner,
the
yeah.
coroner to do that? How do you get all that worked out?
Yeah, as far as the medical director, his job would be to kind of help us. Sometimes, first off, we have a list of standing orders. Every patient has a list of standing orders that all the doctors will sign off on, which makes everything very nice. It's very we can expedite things a lot quicker versus having to wait on a doctor to give us an order. So that's always good because if in the middle of the night we have somebody in a pain crisis, we can't wait for the medical director to give us orders. So, but his job is to, if there's times when we're unsure about what to do, we'll contact him and say, look, Dr. McDonald, we don't know what to do. This or that's going on. This isn't working. Can you, what do you think? He'll help us in that realm. He signs all of our paperwork. On admit, a patient has to have their primary doctor and our medical director to sign off that the patient is considered terminal. So on admit, we have to have those two physicians' signatures therefore, afterwards, we don't have to have but just one physician's signature, and that's typically Dr. McDonald, our medical director. So we have a meeting every 2 weeks. That's a federal reg that hospice meets the whole team, social worker, medical director, aide, everybody. We all come together, and we discuss, we discuss all the patients and stuff. And so the doctor's there, and we're able to collaborate with him in detail about each patient, and he'll give us orders or whatever, suggestions and stuff on what we need to do.
So he doesn't have to pronounce that patient dead?
No, no, that is going to be, it's a parish, every parish is different. So typically we have to call the coroner. Sometimes the coroner does not come out. Sometimes it'll be the deputy sheriff or maybe, another person, assistant coroner or whatever, they'll come out and pronounce. Yeah.
And that typically happens at home.
Mm-hmm.
So what happens, because this could happen at 1 a.m.
That's right.
So you probably, the funeral home,
Mm-hmm.
do you guys help with all that? Or?
Oh, yeah.
Okay.
And that's probably one thing I should have told you at the very beginning. Hospice, the nurses for hospice are on call all the time. So once you get on hospice, there will be no more 911 phone calls. The RN for hospice is on call all the time, and they have to be available, and we have to be there if need be within an hour. So it could be 2 in the morning. If there's a need, you call the hospice number. The answering service contacts the nurse that's on call. So we are the 911 service basically for that patient and the family. So that's a huge thing for Medicare. It would be no more 911 phone calls.
So are there any situations where the medical director has to come out to that home?
Yeah.
Are there any critical situations that require his presence?
Well, Medicare, first off, we have to do face-to-face visits, and that's going to be after the patient's been on service for 6 months. On that third certification, the patient has to have a face-to-face, and that's going to require either the primary doctor or the medical director to come and do a face-to-face visit and fill out all the paperwork.
Okay.
So
Give me an idea, your most common, because what you're saying here is that you need the primary care and the hospice medical director to approve
that's right.
a hospice admission.
Mm-hmm.
There are potential hospice patients that may not be admitted by the medical director, am I correct? He may say, I don't think this qualifies. Or maybe a primary care doctor, maybe, I don't think this qualifies.
Yeah, I mean, because first off, before the patient can even be admitted to hospice, we have to have an order, and typically it's going to come from their primary doctor or maybe their oncologist or something.
Right.
If we get it from an oncologist, depends on where they're from. If it's going to be really hard for us to get the paperwork signed, we will contact their primary doctor and say, hey, look, his oncologist called. Are you okay with signing off on the admit paperwork for hospice? Here's what the lab work says, or here's what the the scans are showing, or whatever, the biopsies. So we will make sure that the physician knows what's going on. And
what are your most common reasons for admitting? Like I'm sure cancer is at the top.
actually, cancer is probably third or fourth.
Really?
It's mainly Alzheimer's
Really?
and lung patients, COPD.
Really?
Yeah, but yeah.
I saw a patient, I had a patient, and he was admitted to hospice for sickle cell disease. And I had
Wow.
never seen that.
I hadn't seen that either. I surely
And he
haven't.
died within 3 months.
Wow.
But again, I guess he would, and this is why I'm saying this openly on TV, because if a patient is in the hospital repeatedly,
That's right.
some ERs will use hospice as a, what should I call it, as as an excuse to get the person not to come to the ER.
Yeah, yeah.
I mean, that's the only way I can explain it.
And truly, I mean, if that patient has got constant ER visits or constant hospitalizations, something's going on there physically that maybe the patient, maybe they do qualify for hospice too. So, but yeah, I know what you mean.
But he came in and he was gone between, I mean, he died shortly after he was put on hospice. So he wasn't my patient. I just heard about him and I said, something went off in my mind. I was like, maybe he wasn't a classic hospice case. So you're saying Alzheimer's, number one, COPD, there may be cancer, there may be heart failure.
Oh, yeah.
Okay.
Yeah.
Wow, that means we're seeing a lot of Alzheimer's in our community.
Oh, yeah.
Wow,
It surely is.
that's unbelievable.
Yeah.
The devil is busy, but God is at work. Yeah.
That's right.
You know, the Bible says God has not given us the spirit of fear, but power and love and of a sound mind. And I think we have to keep speaking that over ourselves as believers, because the devil is going to try to talk to you. Your dad had Alzheimer's, your mom had Alzheimer's.
That's right.
Go get yourself tested. You're going to every morning you wake up and say, God has given me the spirit of a sound mind.
That's right.
I will not die forgetting my children.
That's right. That's right.
Seriously, if you're a believer, the Bible makes it clear that you have a sound mind. Don't get yourself into that logjam where you think, I can't get out of this situation because it's so, so I'm happy that works. Awesome. So technically you cut out the hospital from hospice more. The hospice patient has very little reason to go to the hospital.
That's right.
Because they have a 24-hour nurse.
That's right.
Who can come at their beck and call to take care of them.
Right.
Yeah.
The only time really that maybe the patient would have to get off hospice and go into the hospital would be something acute. Maybe they had fallen and with a fracture. If it's something that we can't maintain there at the house or in the facility, we'll have to send them out. But typically we can maintain whatever it is. But I mean, sometimes, things that are totally unrelated to their diagnosis comes up. And if
I notice a lot of hospices have home health as well. So people get confused because they say, oh, is it the home health or the hospice? Is there a relationship? Or is it a lot of people just have both in the same company? Right. Have you noticed a lot of companies have both?
Oh, yeah.
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 So I guess you cannot have home health and hospice, right?
You can, but it's best not to do it because it becomes very, Medicare looks at it as though you're double dipping. You cannot have both services for the same diagnosis. If you're going to do it, you have to make sure you document and your diagnoses are totally different and stuff. So a lot of times it backfires and it's not even worth it. So one or the other usually just pulls out and says,
So Crossroads just does hospice. Okay.
That's right.
Wow, we've got a lot of education. I'm learning. I didn't know there were a lot of things that Ms. Mary Beth said today that I wasn't aware of. And I'm sure that you learned a lot as well about hospice nursing. But don't change that dial. We're going to be back next week. You don't want to miss our talk. We're going to be talking about hospice nursing, how she got into it, and what the future holds in this career for her. Ms. Mary Beth is going to be with us next week. She's the Director of Nursing for Crossroads Hospice. And we're going to be sharing also on her faith and how that has sustained her through this time as a hospice nurse. I'm Dr. Toby, and this is Mary Beth, telling you that Jesus is Lord. Join us next week for another great time on this show, Health and Wellness with Dr. Toby. God bless you.
Amen.
Awesome. Great job.